who's it going to benefit more? Why?
Meningitis. It's too quick.
Yeah.
Need to just get in there.
I'm not sure if it's just an ethical issue, because actually when you go through medical problems, medical cases like this, you actually get down to the fact that it's like when you call the ambulance and you tell what the patient's got, there is a list, a risk priority list, priority list. So if the patient's bleeding, they're in a certain position, the ambulance will be here in within an hour. If the patient fell unconscious but breathing, they'll probably be here in 20 minutes. But if the patient is unconscious and non-breathing, they'll probably be here within 5 minutes. So it's not just about an ethical issue, but it's what is, because at least this case doesn't tell what the other patients have. So I can't really, in my head, see if I can compare and see which one needs more
Well, what would you answer?
care. Pardon?
It has to be Barry, because it's the criticality of the person concerned at the time, and the question of, is he going to live if he gets an ICU place? The other people there, they're critically ill, but they're not on death's door.
They're relatively stable,
Yeah.
yeah.
So
Plus, he was fit and well before, so he's...
And renal
Got every
failure.
chance.
And renal failure shows.
I think you still have to take that chance.
If there is 1% in a million, it's still a percentage and it still should be taken, because it's not, it's again coming across that fact, as you say, should that person be given an opportunity, and it's under human rights legislation that you should give treatment. Every single being has the right to have to be treated and provided with health and care, and it's not down to the doctor to decide if, unless they are dead, that's when you don't continue treatment, but every single individual should have fair and equal treatment.
Any other opinions there?
What about the other patient? If there's a risk of moving him, any long-term effects on the patient?
The patient is relatively stable, so that they still survive and they can move him.
But you need to think about if there's any long-term effects of moving him.
So yeah, you can consider that at the same time. So then you consider someone who wouldn't be affected in general.
You're in an ICU.
No, I couldn't hear what she said. Can you?
No, I can just pick someone who is stable and who won't be affected if you move them. I think it's very
What if they're both going to be affected? What would you do?
But Barry is going to be affected more.
But wouldn't Barry won't deny him access to the ICU? So just take it from minutes longer. So it also depends on the mode of transport.
And it was a back road. Second time.
Someone here summed it up really nicely. I don't know who it was, sorry. You said you can't do nothing? Who said that? Spot on, dude. Sorry, like, the legal ramifications, blah, human rights, blah. The reason you become a doctor is because you want to be involved in a caring profession. So as a doctor, it is against every single instinct in your being to sit there and watch this person suffer. So, well done, dude. I agree with you. You can't do nothing.
Anyone else? Or should we move on? Mike? Yeah.
You are?
Covered everything, all the points.
All right.
Has anyone got anything to say about it?
So what, just out of interest, what would be the vote to say he should stay where he is, or he should be carted off somewhere else? Who would say he should stay where he is? In the ICU?
So, yes.
Yeah? And everyone else says he should be carted off?
Really? I don't know.
Hands that.
I think it depends on what
the
rules are about the
So
thing.
basically, if he stays, someone else has to be transferred. Is that what you
Yeah.
Someone else has to be transferred. If he goes, he's a risk by having to travel that distance.
He's more likely to die if he's transferred.
We got an idea here. Sorry.
He's more likely to die if he's transferred.
Yeah.
It seems from this information than someone who's more stable in the ICU at the moment.
Especially if you look at the suddenness, because if you see on there it says he's been fit and well up until that time.
And
It must be acute.
And renal failure is really serious because you die from that. So.
What do you think, sorry?
I was just saying, you know the point that the organ transport and so that's also depending on how you go and how long it's going to take you. So.
But 50 miles, you know, it's an hour.
Yeah.
An hour on motorway.
If you had a helicopter, would
Yeah.
10, 15 minutes to get there. It's take 10 minutes to fly.
It could be as long as it takes to put in the
It could be.
elevator into the
Well, the only thing that in this case, first of all, you don't know the other patients.
Exactly, that's what I was
That
thinking.
would be my argument. First of all, you don't know the other patient's circumstances. As Lenny said, renal failure would lead to death pretty quick, but could be possibly brain damage, could be possibly heart disease. However, these other people had a primary service already, so they've been treated already in some way. So they are reacting to something, and if they are to be transferred, they'll probably be. Obviously, it says that they will.
They're relatively stable.
Increases their chances of complications, but again, it's just the case of you need to give the primary. They're going to be transferred with the right medication during the process, whereas these men haven't had any at all. So obviously, it's the risk that it's higher that should be taken as priority.
Yeah?
Yeah.
You all agree with that?
That would be my
Certain
argument.
death or complication.
Yeah.
You can also consider that the other patients are suffering from something else. Maybe there'll be some type of equipment which can be used during the transfer, so they can be on that equipment. While his condition may mean that there is no equipment apart from what is in the ICU.
Yeah, no, I agree with that. Something from what you both said, I could add on is basically probably just reword what you said. With all the other patients in ICU, we know what they need to be treated. We know their background history, blah blah blah. With this patient, it's quite sudden, so I think we have more control over the other patients rather than this. This is just coming to the site of treatment. So
yeah, he almost needs a setting first of all, and then at least
we
be taken from there.
We know more about the other patients, right? So.